Hi, my name is Dr. Phil Memley, and I'm here to discuss safe amalgam removal and beyond. By beyond, what we're really referring to is that there are two accepted precepts, which may not be considered to be scientific facts, but these are the things that are accepted as safe amalgam removal. If mercury is removed under the proper conditions, then it's considered to be safe and effective. And you might have heard statements to the effect that the rubber dam is the gold standard for holistic dentistry. The question is, does this hold up under the new findings? Any dental material which is a non-metal, such as a composite or ceramic, is biocompatible and therefore utilizable. The key question is this true? And does the standard have to be modified? There have been at least 4 findings, which are both clinical and research-oriented, that have challenged these foundations. The first being detoxification. Once amalgam has been removed from the person's mouth, the result is that the levels of mercury in the bloodstream tend to go down. And when they go down, the cells sense that there is less mercury and they start to release the mercury back into the bloodstream. This can create various problems for the person. So this is something that is not really being addressed by our foundational concepts. The second concept is the dental nerve. This is more so a clinical finding. A lot of people are finding that after the mercury is removed, that their teeth are now sensitive for a long time or permanently, or that the nerve has died, which could necessitate having the tooth removed or having a root canal done, all of which we are trying to avoid. The third point is safe dental materials. The concept here is we don't want to remove what might be a poison to one person and put another poison into their mouth. This is the science of biocompatibility. So this is another area that we're going to look at. And the fourth area might be long-term dental health. Mercury fillings are used by a lot of dentists because they're strong and they hold up for a long time. Once we replace mercury fillings, we need to find materials that are going to be good for the long term. So what applies for mercury may not apply for composite or ceramic restorations. That being said, we're going to start looking at each point one at a time. First point that we want to go over is detoxification. Detoxification, along with the immune system, are probably the two most personalized systems in the body. My immune system and my detoxification system are varied and complicated, and there may not be another person on the planet who have similar systems to I. The question becomes, do I need an individualized program, or will one product handle the complexities and the long-term necessity of doing the detoxification? This is an important issue. It's highly unlikely that one product can address all of these demands. Right now, the concept that one product can do this is very prevalent. A lot of people notice that, yes, one product can reduce initially mercury levels in the bloodstream, also can reduce somebody's symptoms. The body, if it's desperate and it's highly toxic, will accept a product and will work with it up to a certain extent. Once that priority has gone down, once some of the toxicity has been removed, now the body will stop utilizing that product. Then people will make the assumption that I'm healthy now, or I've gotten rid of most of my heavy metal toxicity. And this is not the case. Good side of the individual protocol is it's addressing your individuality. However, that may require longer time. It may require dietary changes, which some people may not want to make. In the long run, you will be healthier and you will have achieved a higher level of detoxification. This may have to be done through biofeedback. It may have to be done through acupuncture. Some people may consider that these methods are a little bit more subjective, but in the right hands and in the right person, these techniques can be highly effective. There is a famous protocol out there. It's called the Cutler Protocol. This protocol has made people feel better and has made blood levels go deeper. However, blood levels don't reflect what's going on in the cells and in another tissue called the matrix. The matrix is actually between the bloodstream and the cells, and there could be a high storage. Technically, in a healthy person, it's stored with minerals. In an unhealthy person or a person who has accumulated a lot of heavy metals, it will be filled with toxic heavy metals. We can't see into that. And what I have seen from my perspective, this technique, which utilizes pharmacologics, will initially give improved symptoms and improved blood results, but it doesn't really make a reflection or an impact on the deeper levels. A lot of these people end up with some mercury and kidney difficulties, okay, which need to be addressed at a later time, which are very difficult to diagnose with current diagnostic techniques. I caution people before utilizing those type of techniques. After amalgam removal, there is a high percentage of teeth that the nerve becomes sensitive or the nerve actually dies. When I say sensitivity, the sensitivity could last for days, weeks, months, or permanently. Once a nerve dies, that nerve needs to be treated on a permanent or predictable basis. We either have to utilize a root canal, which is not something I generally advise people to do, or extraction of the tooth. Again, if that tooth gets extracted, we may be required to do a tooth replacement, which involves implants or involves a bridge or a removable device. At the initial exam, when we're considering the amalgam removal, the status of the nerve needs to be assessed. We need to determine, are these healthy nerves? Are these nerves undergoing inflammation? Are these nerves dying, or are they in a degenerative state? And generally in dentistry, this is not considered, but there are a lot of things which affect inflammation and degeneration of nerve. One is clenching. Now, 90% of the population who clenches in a study was found not to realize that they actually clench. Another consideration is diet. There are things in the diet which are neurotoxic. Coffee, for one example, can have 100 chemicals in it that are neurotoxic. Nicotine, okay? Also, are there structural issues on the teeth? Like, is there decay near the nerve? Are there fillings near the nerve? These are other things that need to be taken in consideration. So again, before amalgam removal is done, we need to assess the nerves, and then we need to determine if treatment of those nerves must be done to minimize the risk of a nerve dying. That if we're taking out one material that might be toxic to one person or might not be biocompatible to somebody, we don't want to put another material in that's non-biocompatible. And you can't go on the assumption that a composite or any ceramic is compatible. A lot of holistic dentists have told their patients, I've been using this product or this cement or these restorations for 30 years or 20 years, and I've never had a complaint from any of my patients. Well, this statement violates the concept of biological individuality. I had stated earlier that in terms of our DNA, our genetics, we have the highest variability among detoxification and among the immune system. Both of these systems are affected by whatever we put in our mouth. Once we put something in our mouth, it's going to have a 24/7 effect on our detox and our immune system. So it behooves us to select products or dental materials which we're permanently putting in our mouths, not to have a negative impact, particularly on these systems. What might be safe for one person may not be safe for another. So there has to be some form of biocompatibility testing. One test, Just Clifford, basically invented a Clifford compatibility test. He studies the immunological aspect of materials. All right, so he studies, his test is an FDA accepted test, and it studies how these materials affect your immune system. This is important. Another technique, which actually can assess both systems and more, is a biofeedback type of system, which could be done through applied kinesiology, muscle testing, acupuncture testing. There's various methods. A lot of people state, you know, I want the most objective test possible. Objective testing has a lot of inherent errors with sensitivity and specificity. More subjective tests may, if the tester and the individual are a good match, they can actually be just as accurate. So I tell people not to poo-poo any technique. At the end of the day, the point is that when we remove something out of your teeth that may not be acceptable for you, we want to place something that's going to be healthy and safe. That may not be a simple matter of just utilizing what I've been utilizing for 30 years or picking something out of a book. We have biocompatible individuality because of our DNA, so the whole process of amalgam removal and the process of putting new materials in must be individualized. Long-term dental health. I had made the earlier statement that dentists love mercury fillings because mercury fillings are quick and efficient to do, and they have a good long-term prognosis in the mouth. Ceramics and composites are susceptible to other matters. They're susceptible to stress. The bite has to be taken into consideration. There's other factors that have to be consideration. So in terms of utilizing taking a mercury filling out and just automatically placing another filling, okay, without proper diagnosis of the tooth and assessment of your overall condition, may not be acceptable for people in the long run. What I find is that the selection of the type of filling, and I'm going to get into different type of fillings, the selection of different filling types affects the long-term prognosis, meaning we really have to assess the mouth, not just the teeth. We have to assess it functionally, the bite. We have to assess it in terms of soft tissue, in terms of periodontal, and possibly bone loss or gum recession, which we're trying to prevent. We also have to assess it in terms of structurally, because if I place a weak filling in a weak tooth, I may, in a short term or long term, promote a root canal or promote the death of that nerve. Again, this has to be assessed at the beginning. How strong is this tooth, and what are my requirements for putting a proper filling? When we're looking at this, we can assess these in certain ways, and I call this filling typing. It's not generally taught in dental. I just find it appeared to me to be very effective for those people like myself who are doing a lot of amalgam replacement. There's going to be different fillings that are done in the back of the mouth, the posterior versus the front of the mouth. There's different forces. What I might call a type 1 situation might be where I have a strong tooth. If I have a strong tooth and there's not a high functional demand, meaning this person's not grinding a lot, and there's not periodontal issues, then that tooth is a strong tooth. And I can place any type of filling in there. I can place a weak filling and it can last for 20 or 30 years. Okay, that's a situation that can be addressed. Our fourth consideration here is long-term dental health. The idea is that just like one material isn't suitable for every person, the same filling type is not suitable for every tooth. The fourth point that I would like to discuss is long-term dental health. When we have our mercury fillings replaced or have any fillings done, the idea, the underlying assumption is that we want this done for the long term. I don't want to have to come back in a year or 2 or 3 years and replace the tooth. Biocompatibility is something that must be addressed. We have to address proper selection of dental fillings. The three major considerations that have to be considered are the strength of the tooth, the structural strength of that tooth. The next would be functional. That's how much pressure is actually being delivered to the tooth. And then the third might be the conditions of the gums, because with the conditions of the gums, we're trying to avoid bone loss around each tooth and gum recession. We don't want to replace a filling and then end up with a problem that we didn't have before. In terms of a long-term selection of a tooth, these considerations, structure, function, and periodontal, these need to be put together or to select the proper filling. The first type of filling, the consideration if there's a strong tooth, a weak filling can be put into it. And that seems pretty obvious. If I have a strong tooth and there's low function and the periodontium seems to be functioning well, we could put any filling in that. That's not a problem. The problems start with the next. Between teeth, there's what we call contacts, and that contact determines how tight the teeth are, and that affects more periodontal. So if the contacts are loose, if we can't get a tight contact with a certain type of filling, food can get jammed in. That food can cause decay under the new fillings. It can cause bone loss and gum recession, which might require a crown later. We need to identify that at the beginning, and we need to make corrections for that, make the proper filling selection, and that filling might be an inlay. The next consideration would be an onlay. When would we use an onlay? We would use an onlay when there is a structurally weak tooth. Onlay is something that might be considered to be between a filling and a crown. Okay, so we're doing an onlay because there's an inherent weakness, structural weakness in that tooth, which we need to address, and we're trying to do this conservatively, preventing a crown. The next type of situation would be where the tooth is completely compromised, either structurally or functionally or periodontally, and then we have to address it with the crown. And a lot of people may say, well, I want to avoid a crown, but then there's the consideration, am I going to cause more damage later? This all has to be assessed up front and discussed. We have discussed two things which are accepted by holistic dentists. There's these new things that require more individualization. It requires more factors to be looked at before, and it requires for these things to be discussed with the patient so that a proper long-term program can come up, which is going to ensure your long-term health and long-term dental health. Thank you. Have a great day.